how do we build trust in medicine? How do we engender confidence in communities that are hesitant? Part of it is representation matters.
Yep.
Netflix seems to get it. I can turn on, find a playlist of things, every show that I put on for my kids. There is so much more representation now on television, specifically on Netflix. Some channels are better than others, but what about in medicine? In
Right.
medicine, and I can't, in my group of 7 OBGYNs, 2 are African American. Part of the work of Patients Are Waiting is increasing diversity in medicine. Why? Because it saves lives. That when we see racial disparities in healthcare, in medicine, they are addressed partially by having diversity within the healthcare workforce.
Let me throw out that it's also poverty. So we have redlining, and the redlining maps line up exactly with where we see life expectancy differences. But all of those things are also connected deeply to poverty. They're connected deeply to trauma. We know that children with 6 or more adverse childhood experiences have 20 years less life expectancy. And we also know from the Philadelphia study that there's more than those 10 original ACEs. So when the Philadelphia ACEs study looked at an urban population that was much more diverse, what they found was that the traumas were at a higher rate, and they included things like experiencing racism and discrimination. They included things like being in congregate care, so foster care and the juvenile justice system, both of which we know disproportionately affect people of color. It's this combination of all of these things, and it forces people into the situation where they're under-resourced.
Within our strategy plan, what we try to do is analysis on different regions. So the idea is to engage the leadership to be able to fill in the gaps as to where, what areas, what certain parts of the community are not getting serviced, or there's just basically a gap in between, and we're just not connecting with them. So my idea is, at least in a commission standpoint, what we try to do is engage with the leadership to identify those gaps so that we can be able to resource in whichever way possible.
If we're talking specifically about vaccine hesitancy, I would appeal to my fellow white Christians, please get vaccinated, talk openly about it, address the concerns, and celebrate the progress that we can make against this pandemic together.